Hi, is it Fiona Collins?
Hi, yeah, you can call me Fiona.
Hi Fiona, I'm Raphael. I'm one of the doctors on the ward looking
Hi.
after your brother Nathan.
Hi doctor, nice to meet you.
My understanding is you've come here today to speak a little bit about this new medication we're starting for him, is that right?
Yeah, Clozapine, I've heard, is that right?
Yeah, Clozapine.
Clozapine. Yeah, I've got quite a lot of questions, but also just feeling a bit exhausted and hoping you can give me some hope, to be honest.
Yeah, tell me about how have things been with you and your brother, how have things been?
Really difficult. As you know, he's got schizophrenia, but he's tried so many different medications and none of them have really worked. And it's just horrible to see him so unwell for so long.
Yeah, it's really hugely difficult and
Yeah.
I'm really sorry that's happened. And I think in a way that leads us nicely on to Clozapine because it's a medication that we use when other medications aren't working, which is, I guess, kind of what's happened with Nathan.
Well, I was going to ask, yeah, why haven't we used it before?
Yeah, so Clozapine it's a really good medication. We know it works for people when other medications don't. And so we use it once one or two or more other medications don't work.
Right.
But it does have a number of side effects. So that's one of the reasons we don't use it straight away.
Oh, because the other medications had side effects. So what side effects does Clozapine have?
Yeah, that's definitely something that's going to be important to talk about.
Yeah.
So obviously every medication has side effects and it's a balance. And from what I understand with Nathan, he's just really not getting better. And obviously he's so ill, he's got to be in hospital. And the other medications just don't seem to be working for him and improving his worries about others, these voices he's hearing, which seem really distressing
They
for
haven't
him.
really worked much at all, to be honest with you. Yeah.
So Clozapine is a medication that can be really effective for people where other medications haven't worked. But the side effects it has, and we kind of split them into things that maybe are more common and things that are a bit rarer but are important to monitor because they can be harmful if we don't do something about them.
Okay.
So in terms of what the common side effects are is sometimes people can find that Clozapine can make them quite sleepy. That's often an effect that starts and then gets better over time. And we often have to just make sure that with all of these side effects, we adjust the dose to make sure that we're getting it right.
Yeah.
People can often find that they end up producing a bit more saliva.
I think you might have had that with the previous medication as well.
And if that happens, again, we can think about dose, but there's also other medications we can give to try and control that.
Okay.
And then some people can also gain a bit of weight on Clozapine.
Oh gosh, she's already gained weight on olanzapine.
Yeah, I know. And I think that's something that's really important for us to monitor and like I say, put in place other things. So sometimes we give a medication like metformin to try and reduce that. And we also really encourage people to, exercise, to eat well. And we do that proactively to try and minimise that weight gain.
Yeah, he is doing a treatment plan for it at the moment,
And I guess I haven't said this already, but we'll give you a leaflet to go home and take home so you don't have to remember everything that we talk about.
You mentioned some of the common... Are there any other common side effects?
Well, I think there's a number of other common side effects. People can get quite dry mouth, people can find that they get a bit constipated. And again, it varies person to person. But those are the ones that we generally think of when we think of Clozapine.
Okay.
In terms of the other ones, there's a few that are really important for us to monitor. So I mentioned before the constipation. In some people that can get really, really severe. And if we aren't careful, it can be quite harmful. So one of the things we do is, while he's in, we monitor people very closely and we keep a track of whether they're going to the loo, and we end up almost always giving them laxatives to help them go to the loo. I
didn't know constipation could be that dangerous.
I know, you wouldn't think it, but it's just something we need to keep an eye on. If you keep an eye on it, it very rarely causes a severe problem.
I'll try and check on it with him as well, because sometimes he has trouble talking to you guys.
Yeah, but we keep a really close eye on that.
Sure.
The other is sometimes it can cause changes in white blood cells, which are kind of the cells that fight infection. So sometimes it can make those go really low. So what we do is we monitor the blood tests regularly. Another important thing that can happen is sometimes it can make the heart get a bit unhappy and inflamed. So alongside those tests to look for the white blood cells, we also just check that the heart is good, and we do an ECG as well to make sure the heart's okay. And we monitor carefully for signs that things are going wrong, like heart pain or anything like that. Pain in the chest. If we monitor these things carefully, it's a pretty safe medication. But it's just, we have to mention it and we have to be careful to monitor that carefully. Does that make sense?
Yeah, it sounds like there are quite a lot of side effects potentially, but that you know what they are and you look out for them. So it sounds okay?
Yeah, no, exactly. And I think it's really important to emphasise this is a really good medication that can be life-changing. So you know,
his life's awful at the moment.
Yeah, so you know, a third of people who don't respond to other medications will respond really well to clozapine and potentially can make a really good recovery. You know, another third will have some degree of response and may get a bit better, but not all the way better. And another third may not respond that well, and we'll have to think about other things we can do.
Okay. Can I just ask, he's had a bit of a problem with taking medications in the past because of his delusions and things. Is it possible to give this medication as an injection? Because that was a possibility with some of the previous ones he's had.
So sometimes what we do with clozapine is there's an injection we can give when we're starting it. So what happens when you start clozapine is you start at a really low dose and you gradually work your way up. And that's an opportunity for us to check that it's working well for him, how good the side effects are, but also monitor all of, you know, those things that we talked about. And we know that those things are a bit less likely to happen if you go slowly than if you just jump straight up. For that titration, you can sometimes give it as an injection if you need to, if people don't want to take the tablet.
Right.
But there isn't like a long-acting injection we can give like there are with some other medications.
But you can give an injection for that specific dose on that day.
Exactly. So what we find is if people are needing an injection all the time, it's not the right medication for them. But some people are resistant at the beginning, and once clozapine starts to work and starts to make them feel better, they're much more willing to take the medication. So then we can transition back to tablet.
Okay, that makes sense. Thank you.
Is there anything else that you wanted to ask?
Would you be stopping any of his medications that he's on at the moment? Like, would he be on clozapine and his current medications, or would you reduce some of those?
The plan would be once we've got the clozapine up to a correct dose and we've monitored the levels in the blood to make sure that it's the right level, we would stop the other medications.
Okay, that would be good because he is a bit zombied at the moment. It'd be nice if he was just on one or two.
Okay. Is there anything else? Anything other questions?
No, I really appreciate you taking the time speaking to me. It's obviously really difficult, but I really appreciate it and hopefully it works.
Thank you very much. Lovely to meet you.
Thank you.